debates and decisions that are shaping our continent now in Europeans.
Vasil Kaniskov fills a special role in his village a few kilometers from Sofia, the capital of Bulgaria. He is an expert in the medicinal properties of plants, knowledge that has been passed down from generation to generation in his family.
Belladonna is used a lot in Bulgarian folk medicine, especially for the nerves.
He's a trained engineer, but has made his career in folk medicine, which he says stretches back 40 centuries in Bulgaria. His waiting room is seldom empty, even though his work is only authorized after official study, yet his patients are satisfied.
We come for this kind of treatment when we're disappointed by more mainstream medicine. None of the antibiotics prescribed for my son have had any effect. I'll keep coming to this man for as long as official medicine fails. And this cost me much less than antibiotics.
The fees here are minimalist, but not the patient's gratitude.
Health is not merchandise. It never will be. I don't know what all the commercial efforts of official medicine will produce in the end, either in Bulgaria or Europe. This impulse to do business in the health sector, it's not trade goods.
Yet since the end of the socialist era in Bulgaria and the free provision of healthcare, money and treatment here are indivisible. This is the capital's most important emergency hospital, Pirogov. The low-paid staff are highly qualified, but work with extremely stretched resources, equipment and supplies. This 10-day-old baby has just been operated on for breathing trouble. Here is the surgeon.
This is my payslip. I earn a base salary with additions according to the operations I do. All told, I earn around the equivalent of 250 euros per month. I can't live on it respectably. It's not enough for a surgeon or a general doctor. So we count on the gratitude of patients rather than our salaries. Some ask for and others simply don't refuse when they're offered more money. In the end, they need it.
Corruption here is called complementary payment for the weaknesses of the system. The hospital runs on a budget which leaves 40% of its needs unmet. Like all the public hospitals, it is stifled in debts. With Bulgaria's adhesion to the European Union, the old guard fear the younger generation will leave en masse.
Most of our young colleagues who earn salaries of around the equivalent of 150 euros per month, that's the average wage for a doctor who's just finished his studies, are unsatisfied. They're very intelligent and competent, ultra-qualified. So I think there's no way they'll want to stay here. They'll leave. It's sad, very sad.
Those who do stay will have to change their ways, says the Club of Bulgarian Journalists Against Corruption. Their last campaign targeting the health sector got a big response. Renetta is the club president. She goes through all the mail they got, all complaints to do with having an operation, getting an invalid certificate, access to medicines, reimbursement for care. It's all subject to paying bribes. What is changing, she says, is that now people will talk about it. She wants this followed up by action.
I can tell you that we've passed on all the complaints we've received to the Interior Ministry. It's our duty.
Georgi has been fighting for 2 years with the help of a foundation that supports victims of criminal malpractice and with the assistance of the vice president of the Bulgarian Gynecologists Federation. Georgi's wife died in childbirth in 2004. These men believe the death was the doctor's fault. The child was overterm, and they say he ought to have been due for a cesarean delivery.
The doctor called us in on a Sunday and asked us to pay the equivalent of 250 euros. He was the one who decided to provoke labor intravenously to force a natural birth. If he'd done a cesarean, he would have needed to bring a whole team, a surgeon, an anaesthetist. And they would have had to divide the money. He didn't think there would be complications, but there was a lot of tearing. She lost liters of blood. They had to operate to take out the uterus, and then they couldn't save her life. It was all the same to the doctor. He could have done a cesarean when things started to go wrong, took a fatal turn. He was sure of himself, thought things would right themselves, and that he'd get away quietly with the money in his pocket.
The doctor in question is semi-retired today, still practicing in a private clinic in Sofia. Dr. Damyanov is ready to risk his own job to help Georgi in his fight for justice. The case has received no response from the General Prosecutor's Office.
I won't give up until I've obtained justice for my wife. This is her. She would have turned 33 yesterday. This is my second child. He was born half dead. He'll never know his mother. This shouldn't happen in the 21st century. It should be like in Europe, and not with corruption like in the Third World.
Dr. Kostov is among those who are building Bulgaria's medical system of tomorrow. He directs one of the country's 30 private clinics. Not just anyone can go to them. The employees of companies that pay towards them can go, or citizens with their own money. It's more costly than the public health system, but here the practitioners are paid what they're worth, the director says. He sees reform as affecting not only medical insurance, but also mentalities.
Très bien remboursé parce que la plupart de cet argent circule dans le.
Society is very badly reimbursed because most of the money circulates in the black market. One pays only when one needs a doctor. One doesn't pay into a health insurance system, which has to redistribute the funds, allowing for reimbursement.
Devant la nécessité de prendre les choses dans ses mains.
Our state must take things in hand, because European standards must also be applied to the rules in Bulgaria.
Réglementé ici aussi en Bulgarie.
Whatever the date and conditions under which Bulgaria becomes a member of the European Union, reform of the country's public healthcare system will remain at the heart of public political debate.
Так се вижда. То просто абсурд.